The knee pain usually occurs of two reasons. One is called traumatic, and in which case there's a trauma involved, and the one is called atraumatic, in which there's no trauma involved. Atraumatic is usually when the knee wears out. It's called osteoarthritis, or it gets inflamed. When it gets inflamed, there is no trauma involved, and it is called rheumatoid arthritis, or it occurs because of the gout. And in case of trauma, where the injury has occurred, and that can involve various parts of the knee. There are 4 ligaments in the knee. 2 are called collateral ligaments, which are on the sides, and 2 are called cruciate ligaments. They are in the center of the knee. And all these 4 ligaments can be torn individually or multi-ligament. And there are 2 types of cartilages in the knee, and one is called meniscus. They are like little discs, and one on the inner side of the knee, one on the outer side of the knee. They can be torn, or they get a tear, and they can give rise to pain in the knee. And there's another cartilage which is called articular cartilage, which can be damaged by injury, and that can also cause pain in the knee. Knee pain is usually associated, as if it is associated with injury, you get pain, and second symptoms is a swelling, and if it is inflamed, it gets red hot, and other symptoms, you get knee feels that his knees wobbly, or it can give way, or it locks, and you are unable to put weight. After the injury, if the knee is swollen and they're unable to put weight, and the knee feels wobbly, and they're unable to move the knee to full range of motion, like flexion and extension, and they should seek the doctor, and they might need urgent treatment. Common treatments are usually surgical and non-surgical. Non-surgical is depending upon the type of injury, and it's usually physiotherapy rehabilitation, and usually it takes about 4 to 6 weeks of physiotherapy, and then people can come back to their normality. But if there is a tear in the meniscus, which can settle with the physio, but if it's not, that requires a surgery. Similarly, the ligaments, initially they require physiotherapy rehabilitation. If the symptoms are not settling, then the next option will be surgical repair or reconstruction. Recovery depends upon the type of injury. If it is done to the ligaments, and the ligament require reconstruction, like anterior cruciate ligament, usually it is done as a day case. One can go home same day, but requires a crutches for 2 to 4 weeks, and then rehab continues for once a week, initially for 6 weeks, and then once fortnight for another 3 months, but should not be able to go back to their normal sports for about 6 to 9 months. And that is for the ligament. And if it is a tear in the cartilage, like meniscus, that is done as a day case, and patient can go home same day. Recovery is usually faster. They are full weight bearing from the day 1, and within 2 weeks they are back to their normal activities.